Hello and welcome to the Dental Realist Podcast. We are the podcast where you'll get real honest information about dentistry, and you will find that we're a little bit different than most other dental podcasts you're used to because we are going to hit topics that no other dental podcast will talk about. We're three practicing dentists. We went to dental school together, and we've been friends ever since. But before we get into some other topics, let's introduce ourselves. My name is Ryder Waldron. I'm a practicing dentist for almost 13 years now. I own my own practice with an associate that works for me, and these guys that I'm podcasting with are just some of my best friends. And let me throw it over to them. Marcus Neff, tell us a little bit about you, Marcus, and how you're doing today.
Sure, this is Marcus Neff. I'm in nice snowy southeast Idaho, and I practice in a corporate setting. It's a company called Health West, and I've been practicing there for about a year and a half. Prior to that, I was in private practice, been out of school for about 13 years, and Troy and Ryder, the other two guys on this podcast, we've been keeping in touch for a long time, and we look forward to sharing our deep thoughts and great insights with each one of you. Troy, we'll kick it to you.
Yeah, thanks. My name's Troy Stevens. I'm practicing Southwest Idaho. I'm at a dental school with these guys nearly 13 years ago. I'm in a two-doctor practice. I'm a 50% owner with another guy, and we've had several associates over the last few years that has worked kind of with us and things like that. And really good. We got 14 staff, big office, pretty busy, a lot of stuff going on. I think with what you'll find with this podcast versus others is, like Ryder mentioned, we're not going to be discussing, what bonding agents to use, what crown and bridge techniques are the best, all this stuff. We're going to talk about stuff that most people don't want to talk about because, dentistry is quite stressful and things like that. But I look forward because we've got a lot of information between the different practices that we've had with Ryder, with his associate Marcus being in multiple things. We've got a lot of information we can share.
Yeah, and Troy is also our resident left-handed dentist. So when you have your left-handed questions, then you can throw those to Troy Stevens, and we'll give out our contact information here in a few minutes. But let's talk about
a left-handed dentist, a right-handed dentist, and a redhead. So
yes,
that's right. We got it covered. We
have our curses and our blessings here on this podcast, and hopefully we'll relate to somebody out there. Let's talk about why we did this podcast, guys. For me, it's because I started noticing that there are a lot of things that stress me out about dentistry, and as we started talking about things, it seemed like you guys had kind of the same stresses and issues and frustrations. And
this should be pretty easy. There were tough things about dental school, but that was dental school, so I figured get out in real life, it's going to be a lot easier. And man, it was like stressful dealing with patients, I did a startup practice when I first got out of school, so trying to get that set up and worried about marketing and then not to mention just having to do the dental procedures themselves on patients that, were paying real money. Just a lot of things about it that weren't the way that I pictured it was going to be. It was just a lot more stressful, a lot more difficult than I thought it was going to be.
Yeah, and talking to Troy and Marcus, I know personally it is almost like therapeutic to talk about some of these things because we can vent and discuss things, and rarely do we discuss what type of procedures that we're doing or a way to do the procedure. Mostly it's about mental stress and emotional stress and things like that. So, Troy, what about you? What are you looking to, or why did you want to be a part of this podcast?
Yeah, thanks. I think I'm in the same kind of boat as you guys. It was interesting because some of the frustrations and the things that you thought were just, your own little personal issues that you were having with dentistry, you find out when we talk to you guys that, all three of us are in the exact same boat. We all had the same pressures and stuff. But when you go to dental meetings, all they talk about is, how do we do the best class 3 aesthetic composite? What bonding agent do we talk about? We don't talk about, holy smokes, man, we just buried ourselves in debt. How are we going to get the heck out of this stuff? We just bought a practice that cost $1 billion. And I'm being, sarcastic a little there. It didn't cost $1 billion, but, it costs a lot of money, and how am am I doing here, 12, 13 years out of school? And, I don't see like I'm making a lot of progress. So those are the things that I thought would be interesting. Should I known that coming out of school, my expectations might have been a little bit different. And that's kind of what kind of strikes me. And I think, kind of going along with you guys too, is we just wanted to let that information out. It's not like it's a bad thing. It's just the fact that nobody talks about it before you go to dental school. Nobody knows, these stresses are going to hit you when you get out. It would be awfully good to know this stuff before I, went to all that education, went into all that debt, and maybe set my expectations a little bit different. So that's kind of where I'd like to do, is just kind of help people to understand, what's going to happen in the future and kind of help them prepare for it.
Yeah, now that's a great point, Troy, because debt is huge, and we have been out of dental school for 13 years almost, and our debt is still huge. And these guys and girls that are getting out of school now are almost double, I think, what we were in debt when we graduated. And I don't know if you guys remember the meeting. It was probably the first month of school where they talked about debt, and basically their discussion on debt was, if you buy a pizza for $9, it's probably going to end up costing you $14 at the end of all your debt repayment. But I think that we've all realized that debt is probably the biggest stress of dentistry right now. At least for me, it is. I think if we didn't have all this, is that about right? Is that how you guys would feel too?
Yes, debt is a killer. The thing that got me, maybe I can just touch on this real quick, and I know we'll be talking about this in future podcasts. I'm sure we can do a whole podcast about debt, but the fact that it doesn't go away quickly. I was assuming, and I know we've talked about this between us three, about, 10 years down the road, I'm going to be out of debt. I'm not going to have this, and I'm going to be able to start making some money, start doing some things I want to do. And we discussed this, here we are almost 13 years, and debt hasn't gone away, and I'm still seem like pretty much the same boat as I am when I came out of school. However, the PPO world that we're living in now has caused profitability to tank. So therefore, I have less money to pay my debt. So that's some of the things that I'm interested in sharing with these folks as well.
Yeah, I agree. I mean, debt, it just hangs there the whole time. I mean, your student loan debt, you come out of school, and if you buy a practice, you're going to pay, you're going to take out a loan for that. If you do a startup practice, there's a big mountain of debt. If you decide, hey, I want to have a house, I want to have a nice car, there's more and more debt. So I think debt's going to be something that we ought to touch on in more depth for sure in our podcast.
Yeah, and I think debt will be, and I think, like Troy said, debt could be an entire podcast, probably multiple podcasts, because there are so many different types of debt. Like Marcus said, student loan debt, practice debt, equipment debt, paying your staff. Sometimes you have to go into debt for that, it seems like. So in just a sec, let's talk about some of the other topics we'll hit on in this podcast, but let's give our contact information first while we're right here. And if you want to get in touch with me, I'm on Twitter at RyderWaldronDDS, and that's probably the best place to get in contact with me. And I talk a lot about Star Wars stuff and other geeky stuff on there too, but we'll mix in some dentistry, but that is the best way to contact me. You can also check out our website. It's www.dentalrealist.com, and you're going to be able to find our podcast on iTunes and Libsyn. And if you go on iTunes and listen and like it, leave us a review. If you hate it, you can leave us a review too, I guess. But tell your friends about us, and if you really hate us, tell your enemies and let them know about us too. But you can email us at mtrguys@gmail.com. And Marcus, where can everybody get in touch with you?
Yeah, probably on Twitter, I'm Marcus_Neff. Maybe that's not that easy to remember. You can email me at mneffdds@me.com. And then we have our Facebook page, Dental Realist. You should be able to find us on there. And like Ryder said, we're on Twitter also. I think you gave our Twitter handle, didn't you?
I gave mine. Our Twitter handle is at Dental Realist, and that we seem to be on there quite a bit also. So hit us up there. Troy, what about you?
Yeah, I'm about the same. I'm at Twitter's TStevensDDS, and that's with a V, not a PH. You can hit us up there. Hit me up there. The email tstevensdds@me.com. We'd really like to get your guys' information on what kind of things you would like us to talk about. like I said, we are practicing dentists. All of us are doing it right now, every day. Some of us more than others, of course. Ryder only works 3 days a week. So.
Well, I mean, I've cut down to 0 days a week right now, but no.
But, we are practicing dentists, so we kind of got our finger on the pulse of dentistry right now, and we just want to talk about things that are, that you can look forward to, and things that you look forward to struggling with, and maybe help you get through some of the stuff.
Yeah, and let's talk about the other projects we've had besides this podcast, ways that we've tried to help out other dentists that have been fairly well received. We've had some books. One of them is called So You Want to Be a Dentist, which can be found on lulu.com and on amazon.com. That is print and ebook. And also our second book is So Now You're a Dentist, and that's mostly geared towards students that have just graduated dental school, new dentists, or ones that are getting close to graduation. And we've just put down as much information as we can think about in a simple way to help students that are going into dental school, getting out of dental school, and ones that are newly out. And Marcus, what do you feel like your biggest motivation was for writing these books?
Just really to let people that are thinking about becoming a dentist really know kind of what to expect, what to plan for, so that they can make kind of an educated choice about, hey, is this career really right for me? And if it is, here's the real things that I'm going to face and that I need to prepare for, so that you can actually hit the ground running and maybe have a little more successful career. And in the other one, if you're actually out there practicing now, you're just getting started. Here's some things that will really help you, be successful and maybe minimize the stresses and have more enjoyment from your career in dentistry.
Now, Troy, do you feel like it's safe to say that when we went into dental school that we really had no idea what we were getting ourselves into? I mean, I felt like we were going to go to dental school, get out of dental school, make a ton of money, be happy, and retire when we were like 45. But that is not exactly what happens. Do you feel like that you wish you had more information before you went to dental school?
Oh, absolutely. And that, going right back to what Marcus just said, that's exactly why we wrote these books, is just to kind of get that information out. We've all collectively figured that you probably cannot fully comprehend what you're getting yourself into when you go to dental school. All of us job shadowed, all of us had been in the dentist's office as watching and observing for many hours before we went to dental school. We've all gone to the dentist every 6 months of our lives. However, being a dentist is a completely different ballgame than just watching and that kind of stuff. When you actually have that, that responsibility on your own shoulders, it's a totally different thing. So, I think
speaking to that,
go ahead.
When I think back when I was going in and job shadowing, I mean, I don't think that the dentist I was watching and I was hanging out with, I don't think he was really going to tell me all the things that kind of suck that go on each day. I mean, so he pretty much just told me, hey, this is great, everything's going well. You see people smiling. He wasn't going to necessarily go into some of the stuff that stressed him out and was difficult. And so it wasn't a really realistic way to get an idea of is dentistry for me, or am I going to like this? Is it going to be tough?
Yeah, that's absolutely true. And even in our books, our first book, So You Want to Be a Dentist, we go into the different outlooks of that, trying to just make people think about it, because I think, like we've discussed here, I don't think I thought about it enough. I didn't think about, how much money am I going to be in debt? What am I actually going to have to do when I get out to own my own business? What am I going to do? How do I run my own business? That's another thing, which by the way, you're not taught in dental school anything about running a dentist, running an office and being an owner. And you find in dentistry, you're everything from the CEO to the grunt. You run the show, and you do all the procedures. With the exception being like hygiene and things like that. But that's the main thing that I kind of wish I could have known a little bit more about, or even just considered it more before I decided to take that leap of faith and head off to dental school.
Yeah, and with this podcast, you're going to get a lot of unique perspectives because Troy's in a partnership, a 50-50 partnership. We've all worked as associates at some point or another for other dentists. I have an associate that works for me I'm a solo owner, but I have another dentist that works for me. And Marcus has been a solo practice owner, and now he's in a group setting, in a corporate setting, I guess. And so you're going to get unique perspective on this podcast. And let's talk about, guys, what kind of things people can expect from this podcast a little more in depth here, because we feel like we're here to help them more in life than in clinical pursuits, I guess. And I think we'll be able to help relate some of the stresses, some of the joys of dentistry, real life dentistry, how it affects your lives, how it affects you not just in the office, but when you get home. Some of the futures of dentistry, where there's a lot of corporations popping up, where we're going to go from here. And you will get some funny stories we had a great time in dental school together. I think the best part about dental school would be our friendships together. And there are some hilarious stories we're going to talk about in our time in dental school, and also since we've been out of dental school. What other stuff can people expect from us, Marcus?
Well, I think we'll share all sorts of interesting insights because we're full of wisdom.
That's right. I mean, if nothing else, we are full of wisdom.
Yes, exactly.
I mean, I think there's a lot of things that you deal with on a daily basis, and it's good to just get it off your chest. I mean, we're not going to sit here and tell you horror stories, but at the same time, we're not going to tell you that everything's wonderful in dentistry either. We're going to just try to give you the real scoop on here's some of the stuff that goes on from day to day, some of the patients that you'll deal with, some of the things that you'll have to manage with your staff, some of the things you do to just kind of try to get away from it all. I mean, different hobbies that seem to work for each one of us to de-stress and enjoy life. So just a variety of that kind of stuff.
Yeah, and I think we'll try to mix in that's a good point, everyday life stuff, what we like to do out of the office. Troy, he likes to do lots of things left-handed out of the office. He rides his bike left-handed.
I do ride my bike left-handed.
He does, yeah. So, Troy, why don't you tell everybody what they won't get from this podcast, because there are some things that if people are tuning in to listen to the dental podcast, they may expect, but tell them what they are not going to get from us.
Yeah, exactly. We touched on it a little earlier, and Marcus, you brought up kind of who would probably benefit from this podcast the most. The seasoned dentist that's been out of dental school for 20, 30 years probably will not find the information we are giving them to be that beneficial. I mean, it may be educational, maybe something just interesting to hear somebody's perspective on it, because those folks, I think, to be honest with you, and you guys maybe agree or disagree, is those guys saw the golden ages of dentistry, which, by the way, we were taught in school that we were going to be in the golden age, but we have found that it's probably not quite the golden age that we were expecting. But the things you won't find is we won't be discussing a lot of, resin, different bonding materials, different equipment and stuff like that. Maybe we'll touch on stuff, just in passing, but we're not going to go into any detail on, what's the best handpiece to use. There is a plethora of information out there about the materials, all this stuff with dentistry. We are going to talk more about the day-to-day grind, why you need to be aware of certain things, how you feel when you get home, how do you, deal with patients and your debt and that kind of stuff. I think that would be the main thing that we would, and kind of looking at the outlook of dentistry and different avenues that you can do when you go into dentistry versus, you don't just have to get out and buy a practice, but that is an option, and things like this. I don't know, Ryder, maybe you can say a few more things on that.
Yeah, I think you guys nailed it. Yeah, we're not going to talk about a lot of clinical dentistry. I mean, if you want to find out how to do the perfect Class 2 composite, you're not going to find it here because we probably don't know how to do the perfect Class 2 composite. But what we do know is how to maybe stay mentally stable after you've had a day of dentistry, and sometimes it's not easy, and sometimes the best thing is just to talk to somebody else that is in that situation, not necessarily talk about dentistry, but we're going to hit on stuff with dealing with staff, maybe sometimes that can be real stressful. We've already talked about debt, and we're going to hit on that more. In our books, we talk about a lot of things that you don't expect when you go into dental school. I mean, I expected to get out of dental school, find a practice to buy, and just be set. I expected the staff was going to come to work happy every day, but it's not true all the time. You're dealing with real people, and they have their real problems at home and out of the office, and stresses in the office, and you do have to manage those things. And sometimes your friends, your spouses, your family, they don't understand, because they see that you have this great income, this great life. And, for the most part, we're not working at nights or on call, but there are stresses that go along, and nobody else can understand that except for another dentist that's been through it. And so we hope to kind of help out with that. Let's talk about some of the stuff we do outside of dentistry, just for fun, things that we enjoy. Marcus, what about you? What do you like to do when you're not in the office?
Well, some of that I don't care to share on this podcast.
That'll be a topic for another show.
That's right. No, when I get home, I like to, I enjoy technology, so I usually pull out the old iPad, play a few games, something like that for a minute. I like the NBA. I'll watch some NBA games. I enjoy being outside in the summertime, and so I work in my yard, plant a little garden, have some 4-H sheep. I don't want to edit that out.
That's staying in.
Yeah, that's for sure.
Yes, I'm a country boy, so I those are some of the things I do.
And Marcus also hates eggs. So, one of our goals on this show is to find a way to get Marcus to eat an entire egg, scrambled, fried, raw. We don't care. In an egg salad sandwich, which is one of Troy and I's favorites. Maybe in a crate.
There's nothing better.
No.
I like to eat an egg, but cook, that is another thing I'll do outside the office.
Yeah.
Troy, what about you? What do you like to do outside the office?
Well, I like to do a lot of things that actually are out of the office. That's one thing I think that we will be going into in our podcast too, is the fact that when you're home, you need to do something besides dentistry, and not think about it much, because you got enough on your plate when you're there, doing it every day. But one thing I like to cycle. I like to ride road bikes. Used to mountain bike a lot, but now I do mostly just road stuff, and I like camping and that kind of ATVing. I used to have a dirt bike, but of course with dentistry, I hurt my shoulder, and I didn't want to end up having to have surgery, so I ended up kind of giving up on the dirt biking for the time being. But I would like to get back into that. Enjoy motorsports. Really like motorsports and things like that. So, you definitely got to have something outside of the office to do to get your mind off it, so you can go in refreshed the next day.
Yeah, and with this podcast, we kind of hope to hit on some of those things, because after a day of dentistry, probably the last thing you want to do is listen to a podcast about clinical dentistry and how to do that. Yeah. So, yeah, I like sports as well, like these guys. These guys actually kind of got me into cycling a little bit the last few years. I never thought I would be wearing a full spandex outfit, but turns out I own several now. And
you wear them to work, right?
Sometimes I wear them under my work clothes. Sure, yeah, no.
Well, that chamois in the really helps when you're sitting on that chair all day.
That's true. That might be helpful.
You will get.
Chafing in dentistry is a big issue.
I mean, that is.
You dentists will find out.
The ADA may want to do a study on the perils of chafing in dentistry, because how many careers have we seen sidelined by chafing in dentistry?
I put on the chamois butter and do a class too.
Dentistry, I mean, have you ever been doing a procedure and you just realize, I just don't have what I need. I don't have that burr. I don't have that right file. I don't have my chamois butter. I mean, you've got to be well prepared for dentistry.
Chamois butter and a number 2 round.
Everything solved by a number.
Everything can be solved. And
the wise words of Cadillac Jack Sneeze.
Yeah, Marcus, why don't you tell us that story right now? I mean, there's got to be some people that can relate to this story, but Marcus had a great experience with an old professor.
Was it Coggs Clinic? Is that what it's called?
Johnston or Coggs? It was one of the.
Anyway, there was this old grizzled dentist. His name was Jack Sneesby, And that guy, you'd go out to that clinic. It was kind of an outreach clinic.
Yeah.
And you're seeing all sorts of different patients, but his answer to any issue you ran into was, well, why don't you pull out a number 2 round burr? I mean, you can gingivectomy, you can do a crown prep.
Crown lengthening, yes.
Yeah, you bet.
Can't do with a number 2 round burr.
No, I mean, I'm racking my brain. I mean, you could extract a tooth with that number 2 round burr, I think. You wedge that thing in there and give a good tug, and that sucker will come out. So, and we'll get a little bit more. I mean, there's some good stories about Cadillac Jack we may hit on in some future episodes. As far as my interests outside of dentistry, I like I said, I like sports. I like the Denver Broncos. I like the Utah Jazz. I'm big into Star Wars. I actually am on a Star Wars podcast called Idiot's Array that I have a lot of fun doing. And I like, Indiana Jones, James Bond. I like spending time with my family, and I like talking to Marcus and Troy. We like to get together as often as we can. We're a few hours away drive-wise, but it is we have a group text going pretty much all day long during our days at work and on the weekends. So we actually are friends. We're dentists, and we hope that you guys will really connect with this podcast because we're going to have a lot of fun doing it. Do you guys have anything else you want to add before we close up today?
Just one, Marcus, sorry, I hope I didn't interrupt you there. I just wanted to mention you mentioned the group texting thing. That's one thing that I think that we found, and the reason why part of the reason why we decided to do this was because every single day Marcus Ryder and I are texting back and forth, and we're always texting about the pressures and the things we're going through, and we're like, man, there's got to be other people out there that are going through the same thing that need someone to talk to about it, or they have questions about it, or something like that. There's a lot of solo practitioners out there that I don't know if they have the same resources we do, where us three just kind of hit it off. And so, as Ryder said at the earlier the podcasts, it's almost therapy. I don't know. Can you guys agree with that? That it's been like therapy to just talk to people about it, because we're all married. We all have friends, but nobody can understand what we're going through except for us. I mean, even spouses that work in the office. I think Ryder, your spouse has helped out in your office or whatever. She's an assistant. She sometimes still has a hard time fully understanding the pressures that you were in as the owner and the CEO of the practice. So this is kind of a therapy session, if anything, too, to help kind of just realize that you're not out there alone and that everybody's going through a lot of this pressure together.
Yeah, I think that's totally true, because I can talk to other friends about things, and they have their own work pressures, but it's just There's something about dentistry that's different, and so we hope to kind of convey that to the listeners. And feel free to hit us up with any questions, any concerns, any topics you want us to touch on, because we'd be happy to do that. That's why we're doing this, is to help other people out that may not know what to expect from dentistry, or may just be in the same position as us. They're veteran dentists, and they just need some sort of help, or anything, some way to vent a situation. But what about you, Marcus? You want to add anything else before we close up today?
No, these guys are my only friends, and so it's really helpful.
That's that I don't have any friends. Everybody hates us, right?
That's right.
Everybody hates Dennis.
It's definitely helpful to have a couple people that know exactly what you're going through, that you can vent to, you can ask questions of, you can share your experiences with. So we hope that you feel kind of, as we go through this podcast, that you're kind of joining our inner circle and becoming part of our group. So definitely send us your questions at Dental Realist. Contact us through Facebook. Our email address is any of that. We'd love to hear your questions and talk about things on our podcast. Yeah,
I'm sure every dentist that's listening to this has been to some dental meeting or a dental convention, and everybody seems happy about dentistry, and you get the feeling that you're the only dentist that has any stress in life, and any procedure doesn't go well, and you feel like you're the only one that's going through that. But yeah, hit us up on Twitter, email us. We'd love to hear from you. Leave us a review, and we will be getting episode 2 out as soon as possible. So we appreciate you joining us tonight, whenever you are joining us, and we will see you next time.